So I have written, the heart and the cardiovascular system, because after the heart, we get into the great vessels, and then gradually get smaller and smaller, and then finally we go into the small little capillaries. So the heart is an organ. The vessels, they are organs. Combination of these organs together makes the cardiovascular heart and the blood vessel system. So I was looking on the website, the person is Leslie Owen Wilson. Yeah, but what I want to show you is James Fraser. James Fraser, he is a Scottish, what would you say, social anthropologist. So let's say might be a philosopher to make it an easier. So just try to read the second principle of magic. So it's a second principle, which means there must be first principle. Anyway, this is the second principle. Things which we have once been in contact with each other continue to act on each other at a distance, even after the physical contact has been severed. So I just want to think and take it whatever way you like. But what I'm trying to say is, if the lectures are pretty substantial, I think these are the information where like in a few years' time, it might come back in your mind, or when you see these information again, at least you feel like you are familiar with. So, but like might be a friends as well. Like we will be good friends together, and then we far apart. And when we meet, we still have the connection. I think that's what he's trying to say. But just try to think and take it on your own way. And I just want to let you know, guys, as well, like whatever subjects you are taking, like you might be taking physiology, you are taking anatomy, like you might have to do microbiology, whatever you have, you need to have a system, like something you must know, something you should know, and something it's good to know. So like must know, should know, good to know. So must know me, it is the basic skeleton. If you do not know must knows, we are not going to pass this exam. So should know me, yes, it's good. Yeah, so you will become a better student. And good to know, hey, so it is a little bit far. You might want to forget about that if you are too tight with time. So yes, so the must know is something we must know. So I think from the lectures that will be transferred to homework, and these are the must know and should knows I just wanted. So must know, should know, and good to know. Yeah, good to know it's like your father and father knowledge. If you don't really need it, if you know it, it's good. So let's go. So the cardiovascular system, this is cardiovascular system because it is, we have a heart here, which is cardiac, and the blood vessel. So this is a cardiovascular system. If we think about that, I have color with the red. Red means arteries, which will take oxygen from the heart, and that way pump, the blood will be spread all over our body, and the blood vessels will be initially, when it comes out from the heart, it's really big, and then gradually get smaller and smaller, and finally they will get to the arterial ends, capillaries. They will become capillaries from the arterial end, and finally they will continue as capillaries, but they will get to the venous end, and these little venous capillaries will gradually become small little venules, V-E-N-U-L-E-S, so very small little tiny veins, and these tiny veins, they will match each other, gradually become bigger vein, and very big veins, which we say vena cava, like superior vena cava, inferior vena cava. These are the biggest blood vessel veins coming back into the heart. And then that way go to the lungs, come back from the lung, get oxygenated, and then pump to the heart again. So this is our cardiovascular system in a simple way. But of course, it is a little bit more than that, the cardiovascular system. This is the heart. And we all know that the heart has got 4 chambers. On the right side, we have right atrium and right ventricle. On the left side, we have left atrium and left ventricle. So all the blood from the head and neck portion, the blood will come back from head and neck with the superior, so upper superior vena cava, meaning venous cava, being big venous vein, and from the whole lower part of the body, we come back into the heart with the inferior vena cava, so inferior below, superior above, superior vena cava and inferior vena cava. They will, all the bloods will come back and go into the right atrium of the heart. From the right atrium, it will have to pass through a little hole, which is guarded with the tricuspid valve. So tricuspid opening into the right ventricle. So into the right ventricle. So the whole body blood come back into the right atrium. The right atrial blood will go into the right ventricle through the tricuspid valve. And then right from the right ventricle, will go into the lungs, which is through the pulmonary valve. So there is a hole into the pulmonary arteries, and these holes are covered with the valves. These valves are called pulmonary valves, and the blood will get into the lungs and get re-oxygenated. And from the lungs, it will come back into the left atrium. So come back into the left atrium through the mitral valve. So there is an opening between the left atrium and left ventricle. This opening is guarded with a door, which is called the valve, which is mitral valve. And get into the left ventricle and through the aortic valve into the aorta, and then go to the whole body again. So that's the repetition, like it's non-stop until we die. So this heart is keep pumping all the time until we die. Even when we sleep, it's keep pumping. When we eat, it's pumping. It's a non-stop. It is a very reliable structure, and it will just serve you for the rest of your life. So right atrium, right ventricle. On the right side, the upper portion is atrium, lower portion is ventricle. On the right side, right atrium and right ventricle. On the left side, left atrium and left ventricle. The whole body blood from the head and neck, superior vena cava will get into the right atrium, inferior vena cava, so the lower part of the body, and the rest of the body will come into the right atrium. All the blood from the whole body will be taken into the right atrium. From the right atrium through the aperture, which is what we call tricuspid. The valve is tricuspid valve into the right ventricle. From the right ventricle through the pulmonary valve into the lungs, get re-oxygenated, and the blood become oxygenated blood. Left atrium come into the left atrium through the mitral valve, come into the left ventricle. And then from the left ventricle, go through the aortic valve into the aorta, which is the biggest trunk, major artery coming out from the heart. And then we go to the whole body. So it is all about cardiovascular system. Of course, we need to know a little bit more detail. So let's keep going. So this is the surface anatomy. So let's say if we are in the classroom, meaning what we should do, take off our clothes, draw heart, marking of the heart on each other's chest. Hey, we are not we are only in the Zoom classroom, so we have to do it on ourselves, just in front of the mirror. So before you have a shower today, I draw a surface marking of the heart on your chest. So what we would do is, on the right side, start with the rib, which is number 3, third rib. So as we know, the rib coming from the vertebral column come out as a bone and become cartilage before it joins the sternum. So the bone became cartilage, which is what we call chondral cartilage, and join the sternum. So the first marking is third costal cartilage chondral marking here, just on the right of the sternum. The second marking is the sixth chondral cartilage. So this is 3, 4, 5, 6. So this is the 6th rib cartilage, 6th chondral cartilage, just on the right side of the sternum. And another point is in the second intercostal space. So this is the first rib. This is the second rib. This is the third, number 3 rib. So second intercostal space is the space below the second rib. So in between second and third ribs, it is called second intercostal space. In between the costal cartilage. So in between costal cartilage, intercostal space. This is the second intercostal space. And number 4 point is the 5th intercostal space in the mid-clavicular line. You have heard about mid-clavicular line already when we are drawing the 9 regions of the abdomen. So just from marker center of the clavicle, and then just draw a perpendicular line here. So that is the mid-intercostal space. Intercostal space in the mid-intercostal line. So if you just try to connect these points, that's the surface marking of our heart. So the question is, how do we know which is second rib? How do we know which is number 3 rib, which is number 4, number 5? How do we count? How do we count which rib is which number? So the best thing is, just like, just in front of your neck, just gradually go down here. You will see a notch. That is the sternum notch. So that is, you come down along your neck in the midline, and you will get to the notch, which is the manubrium sternum notch here. And if you get the point, you just follow slightly, about 2 finger breadth, and you will feel the angle just on the upper portion of the sternum, which is the junction between the manubrium sternum, which is this portion of the sternum, and the body of the sternum here. So there is a little junction, which is made with the short manubrium sternum and the long Cepheid sternum, a long body of the sternum. This angle is called angle of Lewis. So this side, manubrium sternum and body of the sternum, that is the side where the number 2 ribs come and attach to our sternum. And that is the way, you gradually feel the notch, go to the angle, go to trace the side on either side, and you will be on the second rib. So that is the way we count our ribs: 2nd, 3rd, 4th, 5th. So this is the surface marking of the heart. So 3rd costal cartilage, 6th costal cartilage, 2nd intercostal space, just like about 2 centimeters lateral to the sternum, and this is in the 5th intercostal space in the mid-clavicular line. That is our surface marking. So draw yourself before you have a shower today. So yes, of course, the heart is just behind the sternum, which is covered and protected with the ribs and the costal cartilage and the sternum in the front and the thoracic vertebra in the back. And on each side of the heart, on right side and on the left side, we have lungs. This is the right lung, this is the left lung. So the heart is in a space between two lungs and between the sternum anteriorly and the vertebra posteriorly. So now we have a little confined space. That space is boundary by the right side of the lung, left lung. At the front, we got the sternum. At the back, we have the thoracic vertebra. So this is a little space we are talking about. And that space is called mediastinum. So it might sound like a big name, but actually it is not. It's a space where the heart sits. On the right, we have right lungs. On the left, we have left lungs. And at the front, we have the sternum. At the back, we have the thoracic vertebra. And this is the space we are talking about. That is what we call mediastinum. Mediastinum is occupied by the heart. And of course, all the blood vessels, great vessels coming out from the heart will also be in the mediastinum. So now we know the surface anatomy of the heart. Now we know the term mediastinum. Mediastinum is nothing more than a space where the heart sits. That's all. Not just the heart with the blood vessel, major blood vessels. And it is in between the right lungs, left lung, anteriorly, sternum, posteriorly, thoracic vertebra. That is what we call mediastinum. Inside the mediastinum, we have our heart. So this is a cadaveric. Photograph. This is showing the mediastinum. So anterior thoracic wall has been removed. This is the right side. We always say that the cadaver or the patient is in anatomical position. It is we who is standing at the front or at the back, and we are standing at the front of the cadaver. This is the right side, this is the left side, and this is the right lungs, this is the left lung, and we can see the anterior portion of the chest wall has been removed. Look at that, the ribs here, the rib here, the rib here, the rib here, they have been cut open and removed. Now we can see the heart inside the space, which is called mediastinum. And let's try to appreciate this diagram. The heart, the superior vena cava, so the big venous blood vessel, which is carrying all the blood from the head and neck. Look at the size, this is the right, this is the left combination, superior vena cava, right jugular vein, left jugular vein, combination superior vena cava going into the right atrium. And this is the diaphragm. So look at this sheet. This is the diaphragm. A diaphragm is the partition between the thoracic cavity, where the heart and lung stays, and the abdominal cavity, where the intestine and stomach and all the rest viscera stay inside the abdomen. The partition is called diaphragm. Diaphragm is made of muscle and the tendinous structure. So connective tissue, tendinous and musculotendinous structure, which is the partition between the thoracic cavity and abdominal cavity. So look at the heart, which is like a little baby's boot shape, little baby's boot shape, which is just sitting on the diaphragm. And you can see the pointy portion pointing towards the left side. That is what we call apex of the heart. And if you look at that, the heart is covered with the fat as well, you know, on outer surface. So yeah, this is the aorta. Aorta is the big artery coming out from the heart and taking blood to every part of the body. So yeah, so I have posted this on our canvas. Have a look on this video. Like, have a look on this video. Like, it is really interesting, like how they open the heart, how they open the thoracic cavity from the front, how to get reach to the heart. So if you think about that, that's what we saw, isn't it? But with time, we are not going to stay with the cadaver. We are going to move into a clinical environment. I mean, whether you do radiology or nursing or medicine or whatever you do, we have to transfer this information into this, because this is the chest X-ray. That is what we are going to see everyday life. So now we can see the diaphragm, which is the partition between the thorax and the abdomen. We can see the right larynx, which is pretty darkish color. We can see the right larynx here. We can see the left larynx here, and we can see the shadow of the heart. We can see the shadow of the heart. So that is the interpretation of this knowledge, and might be this knowledge, into our clinical practice. So just because we know the surface marking, where is the second cartilage? Yeah, so might be somewhere around here. Well, so second rib here. So 2, 6, 3, 6. Second intercostal space, fifth intercostal space in the mid-clavicular line, where the apex of the heart is. So that is what we need to know from our basic science knowledge anatomy. And if we think about that, where the aortic valve is, the aortic valve is the first place spot we see, like we said, you know, third chondral cartilage. Actually, it is slightly above third cartilage. It is in the second intercostal space. The tricuspid valve, where do you listen? It is, we said, you know, this is like 6th costal cartilage, but it is slightly above that. We have to listen. So the tricuspid valve sounds, if we want to listen, we have to listen in the 5th intercostal space. The same thing like pulmonary valve. Pulmonary valve is in the 2nd intercostal space. So that coincides with our surface marking. And the mitral heart valve sounds, we have to listen in the 2nd intercostal space, mid-clavicular line. So yeah, so gradually getting more and more into clinical knowledge. So if you have a stethoscope, and if you want to listen somebody's heart sound, because we know that there are 4 valves, 4 openings in the heart, which is start with the tricuspid, and then pulmonary, and then mitral, and then aortic valve. And these are the places where you have to listen the heart sound, where you can hear most. So it is pretty much the same like our surface marking of the heart. And the way I try to remember is, AT PM. So AT at PM in the evening. So AT on the right side, PM on the left side. A for aortic valve heart song, where you want to listen. T for tricuspid valve song, where you want to listen the tricuspid valve song. P for pulmonary valve, and M for mitral valve. So mitral valve, if you want to listen to heart sound coming from the mitral valve, you have to listen in the apex of the heart, which is in the 5th intercostal space in the mid-clavicular line. But actually, the valves inside the heart, they are not where we listen. They are somewhere around here, more in the center. Because we are listening, when we say heart sound, we are listening the blood flow that is going through the valves. That is the sound we are listening. Therefore, these areas are the best to listen the blood flow of the heart. But the heart valves are slightly more inside in these areas. And look at that. This is the relationship of the heart valves inside. It is not where we listen. It is slightly more localized in the center of the heart. We are slightly standing a little bit backwards when we listen the heart sound, because that is, we are listening the flow through the heart, and that flow is bad heart, slightly where the heart is flowing from one place to another. So these are the actual space or place, site where the heart valves are. You can see the tricuspid valve, which is between the right atrium and the right ventricle. Pulmonary valve, from the right ventricle, the valve go here. So pulmonary valve is pretty up here. Go to the left, come back into the left atrium, through the mitral valve, into the left ventricle. From the left ventricle, through the aortic valve. Aortic valve is just here. So that is where the heart valves are situated inside our heart. And this is the site where we listen the heart sounds. So slightly different, but it's not far. So this is a little bit more like, more medically orientated diagram. I don't want you to get into this. This is good to know. Let's say must know, should know, and good to know. This is more like good to know. But of course, this is the diagram from our textbook, and this is something we should know. All right, so the same thing, aortic valve on the right second intercostal space. We said, according to our book, our tricuspid valve sound is somewhere around here, 5th intercostal space, but it is more on the left side of the sternum. Pulmonary valve remain the same, like in the 2nd intercostal space. In the 2nd intercostal space on the left side, and mitral valve sound in the apex of the heart, which is the 5th intercostal space in the mid-clavicular line. Although the mitral valve might be somewhere around here. That is where we listen our heart sounds. This is the diagram, like before the stethoscope. So those physicians, in 1800s, when they want to listen somebody's heart sound, this is the way they do it. The physician just get close to somebody's thoracic wall and trying to listen the heart sound. So this is the physician from Paris, France. That's the drawing. It's really lovely. And just because he is doing that, and he gradually recognized, he tried to roll a piece of paper, like try to roll a piece of paper like this, and then listen to the heart sound like that. That's the way they used to listen the patient's heart sound. One was that was 1898. And this is the first stethoscope. And of course, these are the modern stethoscope on the market, like they just elaborate whatever way they get. But that is the way we listen. We used to listen as a physician to listen our patient's heart. And do they know where they should be listening? Might not be, and then gradually with this information, we give us, okay, with the little stethoscope, if we listen here in the second intercostal space, we hear the heart sound of the aortic valve the best. And the aortic heart valve will be somewhere in the center of the heart. We are trying to listen the heart sound here because the direction of the blood flow is from the left ventricle through the aortic valve and come out here. That's why we try to catch from the opposite side and we listen the aortic valve sound somewhere around here. Right, this is a really lovely picture. Okay, so let's go back to our previous knowledge. Our job or our aim is we are going to be somebody who is going to look at these X-ray images every day, or for the rest of our life. And this is the chest X-ray. These are the right lung. This is the left lung. In between two lungs, the space is called mediastinum. In the mediastinum, the heart sit there. The heart is like a little boot, baby's boot. If you have a baby like 3-year-old boy or girl, a boot, their boots are really like that, like very short and very small. And they have an apex here. This is the apex of the heart. It is like a little fist, like the size of the heart is not very big, might be a little fist, which is lying oblique on your chest wall in this position like that. It is pointing downwards and laterally towards the left side. That is our heart. We know the diaphragm. Diaphragm is something which is sitting in between. It's a partition between the thoracic cavity and the abdominal cavity. Diaphragm is made of muscle and fibrous tissue, which is what we call musculofibrous tendinous structure, which is dome shaped. Like on the right side, the right diaphragm is right dome. On the left side, left diaphragm makes left dome of the diaphragm. On the domes of the diaphragm, the heart is just sitting comfortably. And now I have shown a few arrows. Like this is the right border of the heart. This is the inferior surface of the heart. And this is the apex of the heart. So I'm just trying to show you the right border of the heart, inferior surface of the heart, which is sitting on the diaphragm, and the apex of the heart. So the right border of the heart is made of right atrium. So when you see a big bulge on the right border of the heart, you will say, hey, it is coming from the right atrium. The inferior portion of the heart, inferior surface of the heart is sitting on the diaphragm. So this is the inferior surface of the heart. And this is the inferior surface of the heart is made of the small part of the right ventricle, so right ventricle here, and the left ventricle. Most of the left ventricle is making the inferior portion of the heart. And the apex of the heart is made of the left ventricle. So I believe you remember left atrium, left ventricle. So this might be left atrium. So this is the left ventricle, which makes the apex of the heart, and the left ventricle, when doing the apex of the heart, it contributes a large portion on the inferior surface of the heart as well. And the left atrium is in the back of the heart, so which is the posterior portion of the heart. So now, if we see this, we need to know this surface of the heart is made of right atrium. This point, the apex of the heart is made of. Apex of the heart is made of left ventricle. Inferior surface, which is sitting on the diaphragm, is made of mainly of left ventricle and might be part of the right ventricle. And the posterior portion of the heart here is made of the left atrium. So yes, this is right atrium. You can see the now right auricular of right atrium. This is the apex of the heart, which is made of left ventricle. Right ventricle makes the entire anterior surface of the heart, which might contribute a small portion to the inferior surface of the heart. And the left ventricle makes the apex and the inferior portion of the heart. So yes, from this diagram, this cadaver, we have go into this far, and finally we got to this stage. So from today onwards, wherever you are, if you see an X-ray for the chest, I want you to remember which border of the heart is made of which chamber of the heart, inside the heart. So that is the relationship. Right atrium, right ventricle, left atrium, left ventricle. Right atrium makes the entire right border of the heart. Right ventricle makes the anterior surface of the heart. Left atrium is very small, we can see from the front. It makes the posterior surface of the heart. And left ventricle makes the apex of the heart and inferior floor of the heart. And they are sitting on the diaphragm. So that is the reason, you know, if someone has heart attack, myocardial infarction, which is damaging the inferior portion, which is made by the left ventricle, because it is close to the diaphragm, it is close to the stomach and the abdominal content, they tend to get epigastric pain. They are not getting chest pain, they are getting epigastric pain. So we got to be cautious because of the anatomical location, anatomical proximity. The heart attack or myocardial infarction might present with the epigastric pain because of the proximity, because the inferior border of the inferior portion of the heart is just sitting on the diaphragm, and the opposite the diaphragm, we have the stomach, which is in the epigastrium. So epigastric pain in somebody who has got risk factor, just be a little bit cautious. So let's move on. Now we know which chamber of the heart contribute which border of the heart. So let's try to cool down. I have drawn a very simple diagram, and this is a little bit more complex diagram. Yeah, let's start from the heart. This is the heart, and we know that there are 4 chambers on the right side, right atrium and right ventricle. All the blood from the body, superior vena cava, inferior vena cava, will go into the right atrium. And from the right atrium, through an opening, which is guarded with the valve, The valve name is tricuspid valve. Hey, tricuspid, what does it mean? Tri, three, cuspid, 3 little caps. So this valve is made of 3 leaflets. So from the right atrium, through the tricuspid valve, it gets into the right ventricle. From the right ventricle, through the pulmonary valve, here, through the pulmonary valve, into the lungs, deoxygenated blood from the right ventricle, we go through the pulmonary valve, we go into the lungs and get oxygenated, deoxygenated blood and become reoxygenated blood. All the blood from the lungs will come back into the heart, into the left atrium. From the left atrium, we go through an opening which is guarded by the valve, which is mitral valve. Mitral, M-I-T-R-A-L, mitral valve, and it comes from the name mitre, M-I-T-E-R, mitre. So mitre is like a bishop, with the 2 leaflets. It is a bicuspid mitre's head, like bicuspid valve, like it has got 2. So mitral valve and oxygenated blood will come from the lungs into the left atrium, through the mitral valve into the left ventricle, and the left ventricle will pump out blood from the left ventricle through the aortic valve into the whole circulation, into the aorta, and go through the whole body. From the whole body, blood being all the cells will take oxygen, and the deoxygenated blood will come back to the right heart. That's the way we circulate again and again, again and again, again and again. So what we need to take from this slide is, if you look at that, right atrium, deoxygenated blood, right ventricle, deoxygenated blood, through the pulmonary, and the vessel which is leaving the right ventricle, going to the lungs, like right pulmonary and left pulmonary, it is called pulmonary arteries. And all the blood has been reoxygenated, and these reoxygenated blood from the lungs coming back to the heart, and it is called pulmonary veins. What does it mean? It is the term we use, artery or vein, is not dependent on whether they carry oxygen or not. It's mainly based on whether they are leaving the heart or they are coming back into the heart. So this pulmonary artery, look at the pulmonary artery. So the pulmonary trunk itself, and then right pulmonary artery, and then left pulmonary artery. These pulmonary arteries, they are carrying venous blood, deoxygenated blood. And once the blood has been reoxygenated and coming back to the heart, they are carrying oxygenated blood, but the vessels are from the lungs going back into the heart, and therefore they are called pulmonary veins. So whether a vein or an artery, it depends on whether they are leaving the heart or they are coming back into the heart. It is not related to what they carry, what type of blood they carry. It might be oxygenated blood or it might be deoxygenated blood. If the vessel is leaving the heart, that is an artery. If the heart is coming back into the heart, then it is a vein. So yes, it is the basic circulatory system, and this is the basic flow of the blood in our body. So chambers and the surface representation, right atrium contributes to the right border of the heart. You know that already. Right ventricle, most of the anterior surface of the heart. left atrium, most of the posterior surface of the heart, and the apex and the inferior surface of the heart is made of the left ventricle. So it is just a repetition of this. This right border of the heart is made of the right atrium. Apex of the heart is made of left ventricle. The inferior surface of the heart is made of left ventricle. The whole anterior surface of the heart is made of right ventricle, and left atrium might be small somewhere around here, but it makes the posterior surface of the heart. Okay, so I hope this is not too difficult. It's good, you know. Now we have some sort of understanding of our chest and our heart inside, and what is the relationship, and what is the clinical application. Like if we see a chest X-ray, it becomes more meaningful. Of course, we are not just going to look at the chest X-ray. We might be looking ECG as well, or EKG, you know, that's what we call EKG or ECG, electrocardiogram. So this is the way the ECG machine is trying to look at the heart from many different angles. So I believe some of you, who might have done ECG course or EKG technician, or you might have exposed at the workplace EKG. And if you look at the EKG strips, you will see the AVR, AVL, AVF, lead 1, lead 2, lead 3, and V1, V2, V3, V4, V5, V6. That is the standard 12-lead ECG or EKG. So look at that, which is where it's sitting inside. So right AVR, augmented vector, right. So looking the heart from this right 30-degree. This is AVL, augmented vector, AVL, augmented vector left, and AVF, augmented vector foot. So looking at your heart from the right, from the left, and from the bottom. And lead 1, looking at your heart from the left side. Lead 2, inferior left. Lead 3, inferior right. So just try to pinpoint the heart from different angles. And lead 1, 2, 3, 4, 5, 6. So going from right to left across in front of the heart. So this makes a 12-lead ECG. And therefore, if you see something abnormal in lead 2, lead 3, and AVF, so 2, 3 AVF, that's the way we used to say 2, 3 AVF. What does it mean, 2, 3 AVF? 2, 3 AVF means it's all the direction are looking to the heart from the bottom. So if you see something changes on 2, 3 AVF, that means the problem is in the inferior surface of the heart, which is mainly made of the left ventricle. So left ventricle will make the apex of the heart and inferior surface of the heart. And if you see changes in the 1, 2, 3, 4, V1, 2, 3, 4, it is more anterior leads, which might be on the right ventricle, because the anterior surface of the heart is made of right ventricle. If you see some changes more like V5, V6, it might be slightly more related to the left anterior ventricle. So that's the way, ECG or EKG try to look at our heart from 12 different angles. And this is the chest X-ray trying to look at our heart right border, inferior border, and the apex of the heart. And this is the knowledge. If we listen to somebody's heart, that is where we need to listen, which heart sound we want, if when to listen, which heart sound we will. So yes, it's cool. It's even better, really good now. That's our information. So our job is to make information into knowledge. Yeah, information, our basic anatomy information into clinical knowledge. All right, guys, it's nearly 1 hour. So let me take a few more slides, 2 or 3 slides, and I will give you a break. Yes. So now we know this, which is what? Right atrium, right border of the heart, right ventricle, anterior surface of the heart. Left atrium is in the back. We cannot see much of the left atrium from the front, and left ventricle is contributing to the apex of the heart and inferior border of the heart. And this is our 12-lead ECG. So the heart is of course made of muscle, cardiac muscle. We know that. And any organ is a composite structure. So composite means even our skin is made of epithelial cell, but it needs a connective tissue, because on the connective tissue, the epithelial cell will sit on. The same thing, like our bones, bone cells, it's connective tissue. What about our muscle? Muscle is the composite tissue because it is made of muscle cells, multiple sarcomeres, making myofibrils wrapped with the connective tissue, endomysium, perimysium, epimysium, makes the muscle. And the same thing, like the heart is made of cardiac muscle, and we will see the connective tissue which contributes to the heart as well. So let's look at the cardiac muscle. I believe you remember cardiac muscle. So the significance is it is striated muscle. Of course, you can see these striations. And the significance is its branch and its joints, branching and join in a striated muscle. So the skeletal muscle is like a longitudinal cylinder muscle, but this muscle is striation plus branch and join. So that's the cardiac muscle. I think, when we are talking about the muscle, somebody asked me, it might be Michelle, like what are these little like perpendicular structures, black lines? So these are the intercalated discs. I'm not sure.
Thank you. Yeah, when I read it just now on the slide, I was like, oh, intercalated discs, that's what those are called.
Yeah.
I remember that. Yeah.
So now we are getting to somewhere, like from skeletal muscle to cardiac muscle. So let's look at that. What is a cardiac muscle? So I will let you go after this slide. Cardiac muscle is a striated muscle. So pretty similar to the muscle of your bicep muscle. But the difference is this cardiac muscle is different from skeletal muscle because it is short, it branches, it joins, and there are 1 to 2 centrally located nuclei. So this and junction of the cardiac muscles are called intercalated disc. Hey, cardiac muscles, and this is the intercalated disc. And if you just too specific and look at the intercalated disc, it has got 2 regions, transverse region and longitudinal region, fascia adherens and gap junction. Hey, I'm going to stop. I'm not going to explain this at the moment because I don't want to confuse you, because it is nearly at the end of the one part of the lecture. But just remember, take it back, take it all your information about 3 weeks ago. The cardiac muscle is striated muscle, skeletal muscle is striated muscle. The difference is the cardiac muscle is they are short, they do branch and they do join together. And now we can appreciate the intercalated disc. And we have a few nuclei running longitudinally here and there. That is the cardiac muscle. And if you look under the microscope, you can still see the same thing like skeletal muscle. What is the big difference? Of course, they do join. That might be the difference, you know. If I do not know this slide, I might say this is a striated muscle. I have to look for whether they do branch or they do join. And in this picture, I'm not sure, and therefore I will say I don't know. But anyway, you can see what are you seeing? You are seeing the Z disc. Hey, our favorite, yes, Z. So one Z, in between 2Z is called sarcomere. Sarcomere is the striated basic structural unit of the striated muscle, and in between 2Z. And you can see the intercalated disc somewhere around here and there. So that is pretty similar to skeletal muscle. I don't mind if you cannot differentiate this slide, skeletal muscle or cardiac muscle, but this is pretty obvious, and therefore it is something we should appreciate, the difference between skeletal muscle and cardiac muscle. Of course, we will talk about this. This is the cardiac muscle, and these are the intercalated disc here, intercalated disc. That is what we see as a black horizontal line, horizontal to the longitudinal axis of the muscle. That is what we call intercalated disc. Intercalated disc, we are going to see too. All right, guys, I will give you a break. It's about an hour already. So we'll take a 15 minutes break. So let's look at the intercalated disc. Here, look at that. It's like a wavy and windy. It looks like suture joint in our head, cranium bones junction. Yeah. So intercalated disc, which will be seen as a black line, intercalated disc here, intercalated disc, which will be seen as a black line. And that is the junction between one cardiac muscle, end of one cardiac muscle, and the beginning of the second cardiac muscle. And as we know, the cardiac muscle, we do branch and they do join each other. And it is very much like skeletal muscle tissue in many different ways. It's like very similar. I mean, if you look at that, you remember T-tubules in the cardiac muscle. Yes, they do have T-tubules. If you remember sarcoplasmic reticulum, look at the all running longitudinally. Yeah, here we do have sarcoplasmic reticulum. And even like our favorite, you know, I-band, A-band, Z-band, hey, they are all there. So the cardiac muscle, the striated muscle, it's very, very, very similar to our skeletal muscle. Of course, there are a little difference. You know, they do branch, they do join. And cardiac muscle is autonomous, it's beating, is contracting autonomously. And if you look at the intercalated disc region, you are going to see something special. That is the difference, one of the difference between the heart and the skeletal muscle. Let's keep moving. So we said, you know, let's distinct. We do have A, I, H, Z, M. Similar to contraction is similar to the skeletal muscle, but that is what we are going to see here. The intercalated disc, we do not have that in the skeletal muscle. So if we are looking at the intercalated disc region, that is what two things we need to appreciate. Look at that. It's just going Z, 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 going like that. And we do have fascia adherents, and at the same time, they do have gap junctions. So, hey, enough is enough, too much information. We won't be able to remember anything any more than that. So we'll stop there. Gap junction, fascia adherents, these are the two important portions of the intercalated disc. And if you think about that, this is the skeleton, this is a human being, the skin has been stripped off. So all the muscles need to have somewhere to attach, and that is our skeleton. So if we remove all the muscles from the body, we have a skeleton. Skeleton is the core, inner core of the whole body, isn't it? Like all the muscles, they come and attach to the skeleton, and on top of that, we cover ourselves with the skin. So the same thing, like, you know, the heart, they do have cardiac skeleton. So the heart also has skeleton, but of course it is not made of bone. Yes, bone is a connective tissue, but the cardiac skeleton is not made of bone. It is made of connective tissue, the connective tissues, you know, all the muscles of the heart, they are running in a spiral direction. And that is like they contain all the muscles together. And that is the way, you know, if you look at the arrangement of the atria, look at that, they are very much circular. So what's happened if these muscles contract? It will squeeze blood into the ventricle. So right atrium, its muscles are circular, arranged in its circular bundles. So if we squeeze, if this atrium muscle contract, the blood will be squeezed into the right ventricle. If the left atrium contract, the blood will go into the left ventricle. But look at the arrangement of the muscles in the ventricle. They are like a spiral shape and twisting around. So that is the way, if the right ventricle contracts, it will go, the blood will lead into the pulmonary tract and pulmonary arteries. And if the left ventricle, if the muscles contract, the blood will be squeezed into the aorta through the aortic valve. So cardiac skeleton is dense connective tissue around all four heart valves. So cardiac skeleton is like a connective tissue which contains the muscles of the heart. And then it's just spiral around and leave the shape of the muscle. It gives attachment to the heart valves, like the valves we were talking about, tricuspid, pulmonary, mitral, and aortic. It gives attachment to the muscle, and it makes sure the muscle, they do not overdilate. And it also blocks the nerve conduction, because this connective tissue, like the connective tissue, just like do not have any new neuronal structure passing, and therefore this will block the electrical connection inside the heart from one place to another, also that the electrical impulse can go only along the prearranged pathway. So this is a cardiac skeleton. So the whole morning we have been, let's say, wasting our time talking about this mediastinum. Now it's become so easy. So if you draw a surface anatomy of the heart on yourself before you have a shower, and this space is called mediastinum. Inside the mediastinum, we have the heart and we have the major blood vessels, which are just immediately coming out from the heart. The mediastinum is a space in between medial surface of the right lung in the medial surface of the left lung. Anteriorly, we have sternum, and posteriorly, we have the thoracic vertebral bodies. That is the medial spinum. It contains the hardened major blood vessels. So let's look at the heart dearly, like it is a very good diagram looking at the heart. And you remember the superior vena cava, cava means cavus, like enormous, large cava, venous, vena, superior mean above. So all the blood coming from the head and neck came into finally march to become superior vena cava, and it will go into the right atrium. And this red area is called right atrium here, which makes the right border of the heart. And if you look at the inferior vena cava, inferior means below, vena means vein, cava means cavus, large, enormous, large inferior vein. We also go into the right atrium. Right atrium makes the right border of the heart. Right border of the heart. That is the right atrium. And we know that the whole, or nearly the whole anterior surface of the heart is made of right ventricle. This is right ventricle. And left atrium is very small portion we can see because it will contribute to the most posterior portion of the heart. And we can only see a little piece of left atrium. And look at that left ventricle, which makes the apex of the heart, and inferior portion of the heart, which makes the left ventricle. And you can see the pulmonary artery, pulmonary trunk. Initially, it is like a big artery. Therefore, it is called trunk, pulmonary trunk, arising from the right ventricle, taking all the deoxygenated blood, and finally it divides into left pulmonary artery and right pulmonary artery. And it will take the blood to the lungs and get reoxygenated, and all the oxygenated blood from the lungs will come back to the heart with the pulmonary vein. Yes, it is vein, but it is taking oxygenated blood. We name it as vein because it is the vessel coming back into the heart. But look at that. How many pulmonary veins do we have? We have 2 pulmonary veins on the left, and we have 2 pulmonary veins on the right. Hey, in total, there are 4 pulmonary veins in our body, 2 pulmonary veins from the right, 2 pulmonary veins from the left, and all these pulmonary veins which are carrying arterial oxygenated blood into the heart, into the left atrium of the heart. And from the left atrium, the blood, oxygenated blood, will be pushed squeezed into the left ventricle, and the aperture in between two chambers is called the mitral, and the valve names are called mitral valve, and then the heart, the left ventricle, will squeeze all the blood out, all the blood through the aortic valve into the aorta. And don't forget, look at the arrangement between the aorta and the pulmonary trunk. They are both big, but pulmonary trunk is more on the left side and aorta is more on the right side. That's one thing. And pulmonary trunk is more anterior because it is coming from the right ventricle, which makes the anterior portion of the heart. Therefore, pulmonary trunk is more anterior and aorta is more posterior and on the right. Okay, so that is the heart which we have talked about. And look at the blood vessels here. The coronary sulcus, look at the coronary sulcus here. This is the right coronary sulcus, And this is the left coronary sulcus. I hope you remember corona, C-O-R-O-N-A. Corona is something very recently related to our life. Yeah, coronavirus, crown. Corona means crown, like little crown, like a little crown. So which is sitting on our head, like little crown here, like that. Corona, little crown sitting like that. And this is like a corona, like a crown sitting on our heart. And this coronary sulcus divides the heart into upper portion, upper atrium portion, and the lower ventricular portion. It is so lovely, isn't it? The more you understand, it is more meaningful. It makes sense. This coronary sulcus means deep groove. Coronary, like a crown, corona, crown, like a little crown sitting on our head. And this coronary sulcus is like it goes around the cycle around the heart, and it separates the upper portion of the heart and its lower portion of the heart. Upper portions are atria, right atrium, left atrium, and lower portions are right atrium and left ventricle and right ventricle and left ventricle. So this in the right coronary sulcus, we have the right coronary artery. It is too easy to remember. In the right coronary sulcus, we have left coronary artery. And in the left coronary sulcus, which is pretty short, we have the left coronary artery. Let's trace the right coronary artery. Look at that. It is running in between the right atrium and right ventricle. It is running like that. And finally, it will loop around to the back here, and it gives a branch on the margin of the heart. So this is what we call marginal artery here, right marginal artery. So this right coronary artery is carrying oxygenated blood. These coronary artery take blood from the aorta and become right coronary artery and left coronary artery. Let's focus on the right coronary artery. It is in the coronary sulcus, which is separating the right atrium and right ventricle. So can somebody tell me what are the structures this right coronary artery is going to supply, give nutrition? I'm listening. So this right coronary artery is going to give nutrition to which part of the heart?
The right atrium?
Yeah, the right atrium, isn't it? We can see that. The right atrium, and might be here, right ventricle, isn't it? So it is really important, guys. If there is a blockage, it's myocardial infarct, heart attack, myocardial infarct, which is secondary to the blockage of the coronary arteries, might be right coronary artery or might be left coronary artery. If the blockage of the heart of the coronary artery is in the right coronary artery, then which portion of the heart is going to damage? You said right atrium and right ventricle. So the right-sided heart failure, the right side of the heart will not get blood flow anymore, will not get oxygen. There is no more ATP. No more ATP can be generated in these cardiac muscles. And the right side of the heart will die, and they will come with the right-sided heart failure. So don't forget the coronary artery, which artery is supplying which part of the heart. So it's just like, IAT. IAT is going along the San Francisco and Sacramento. If there is any blockage in IAT, everything from Sacramento cannot come to San Francisco. Everything from San Francisco cannot go to Sacramento. That's finished, blocked. The same thing, if the right coronary artery is blocked, so like, it's Fairfield, everything with SEPHA, isn't it? The same thing, like if the right coronary artery is blocked, this right atrium is going to get damaged, right ventricle is going to get damaged. And look at that, you can see the marginal artery, which is arising from the right coronary artery, is running on the inferior border of the heart. So this marginal artery, they will give some blood supply to the anterior portion of the heart, and they might give some blood supply to the inferior portion of the heart. And let's look at the left coronary artery. So left coronary artery is pretty short comparing to the right coronary artery because it's suddenly divided into two. One just directly coming along the, like vertically to the apex of the heart, and the other one is going and looping around towards the back of the heart. So it is looping around the heart is called circumflex. It's just loop around circumflex artery. And this portion of the left coronary artery, which is running in between the right ventricle and the left ventricle, this groove is called in between the ventricle, right ventricle, left ventricle. So we'll give a name interventricular. In between interventricular, of course, it is a groove and depression, interventricular sulcus. So this portion of the heart is running in between inside the interventricular sulcus. So if we want to give a name, which is easy enough, in between two ventricles, in between the right ventricle and the left ventricle, the name is easy. Interventricular artery, interventricular. Of course, it is in front of the heart, and therefore we will say anterior interventricular artery. Anterior interventricular artery is a branch arising from the left coronary artery, running along the interventricular groove, which is a groove between the right ventricle and the left ventricle. Therefore, we will say in between the ventricle, interventricular sulcus, interventricular artery. Everything makes so easy. And the branch portion of the other portion of the heart called left coronary artery will go towards the loop around as a circumflex, loop around to the posterior portion of the heart. So that makes it a bit easier to understand this heart, the blood supply of the heart, because these are important. These are the major blood vessels distributing oxygen to the heart, because the heart is going to use lots and lots of oxygen because it is non-stop. It is contracting and relaxing all the time. Just 1 minute, please. I'm sorry, guys. It is from Hayward. So, okay, where are we now? So we have like right coronary artery, which is running in the right interventricular sulcus, left coronary artery, which divides into left circumflex artery and right anterior interventricular artery in between two ventricles running down to the, so if there is any blockage in the anterior interventricular artery, which part of the heart is going to get damaged? Hey.
The left atrium and ventricle?
Yeah, left ventricle, isn't it? Mainly because left atrium might have some blood supply from this circumflex, but left ventricle is, hey, it is too much dependent on this interventricular artery. So left ventricle is, it's very vulnerable. If you look at that, you know, if you look at right ventricle, it is between two ravers, like this raver, right coronary artery raver, and this interventricular artery raver. It is sitting in between two ravers, so it is richly supplied with the blood. So it is pretty cool. You know, you have rich dad and you have rich mom, so you are cool. If dad is not cool, the mom will give you. So you are sitting in between two. But if you look at this left ventricle, you are very much dependent on this anterior interventricular artery. Look at the portion here, apex of the heart. I mean, can you see any other blood vessel nearby? No, which means if there is any blockage, this heart is going to suffer first. And on top of that, the job of the left ventricle is to pump out blood to the whole body through the aorta. So it is doing the heaviest job among the four chambers of the heart. This right atrium is sitting on top of right ventricle. So if its job is just squeeze a little bit, with the gravity, it will go into the ventricle. Yes, I mean ventricle, right ventricle has to pump out blood into the lung. So if we have a bad lung, right ventricle will suffer, but usually, you know, it's cool. The left ventricle has to pump all the blood towards every part of the body against the gravity, farther away from the body. So this left ventricle is very much dependent on like this anterior interventricular artery. So, you know, when there for coronary artery bypass graft, like if there is a left main coronary artery is blocked, we cannot shy away. We have to do something. Okay. So this is the posterior portion of the heart. That was the anterior aspect of the heart, and this is the posterior aspect of the heart. Let's trace the circumflex artery. Hey, look at that. This is the little circumflex artery running here to the posterior wall of the heart. And if you look at the right coronary artery, which keeps going, look at that. So right coronary artery, which is looping around to the back of the heart, and it gives branch on the margin of the heart, marginal artery. The right coronary artery just looping around to the back of the heart. And you can see the right coronary artery continue as the posterior interventricular artery. So this right coronary artery is running between the, where is it? Left ventricle and the right ventricle. So in between the right and the left ventricle. So the apex of the heart is very much in between the posterior interventricular artery end, which is far away. So look at that, try to relate. This is very much in the center of the heart. This is very much in the center of the heart. and the portion of the left ventricle here in between is very much far away from all the arterial supply sources. And therefore, if someone has heart attack, it is usually in the left ventricle of the heart. So yeah, so left coronary artery is continuing in the, and right coronary artery is continuing in the right coronary cycles, and it will continue as the interventricular artery in between the right ventricle and the left ventricle. Circumflex artery keep running on and on and on here, and it will also give some part to the posterior portion of the left ventricle. Left ventricle is very big, and therefore it needs loss of blood. And yeah, that is the distribution of the heart. So that is the arterial supply. That is the arterial supply for the heart. Here, usually the veins follow the artery. Usually the veins follow the artery, and look at that. The marginal artery has got marginal vein. Interventricular, anterior interventricular artery. Anterior interventricular artery give is going to be followed by interventricular vein, but it is not interventricular vein, it is called great cardiac vein. So the veins for the heart is so simple. The way to remember is here, anterior cardiac artery on the anterior aspect of the heart on the right ventricle, anterior cardiac artery, anterior cardiac vein. And if we look on the back of the heart, we will see the posterior cardiac vein. So at the back of the heart, posterior cardiac vein. And you can see the middle cardiac vein here. Where is the great cardiac vein here? So middle cardiac vein, great cardiac vein, and anterior cardiac vein and posterior cardiac vein. So it's easy. So in front of the heart, it is anterior cardiac vein. At the back of the heart, we have posterior cardiac vein. And the big juicy vein, great cardiac vein, medium-sized vein, middle cardiac vein, and the vein which follow the interventricular artery is interventricular vein. Of course, it's too many names. We will forget that once we stop this lecture, we will forget about this venous blood flow for the heart. But I want you to keep the arterial supply of the heart muscles, right coronary artery and left coronary artery. And that is the way, I think this is the good way to remember. So what we need to do is to draw it down. So from the aorta, we have right coronary artery and we have left coronary artery. Left coronary artery, we divide into left circumflex coronary artery and anterior interventricular artery. The right coronary artery will come down and give a marginal branch, right marginal artery, and it will continue in the posterior wall as the posterior interventricular artery. And there is a little artery called posterior descending. Forget about that. But as a basic, we need to remember from the aorta, right coronary artery, left coronary artery. Left coronary artery will divide into left circumflex and anterior interventricular. Right coronary artery give a branch on the margin, right marginal artery, and continue as the right coronary artery, and finally it becomes the posterior interventricular artery. There is a little artery which is called posterior descending, that is doesn't need to remember. So that is the blood supply of the heart. Why it is important? Because it is any blockage in these artery will give myocardial infarction. Myocardial infarction, which is what we call heart attack, it is coronary artery disease. It's cardiovascular disease. It's one of the leading cause of death. And if you go into the medical field, it is something you will have to face every day. So this anatomy knowledge is important for that. So the same thing I'm going to repeat again. This is the right atrium, right coronary sulcus, inside which we have the right coronary artery, and this might be the marginal artery. This is the right atrium, which contributes to the most of the anterior surface of the heart, right ventricle. And from the right ventricle, you can see the pulmonary trunk going out and then change into right pulmonary artery, left pulmonary artery. And you can see the left coronary artery just peeping out here, and then it just branch into anterior interventricular artery in between two ventricles, circumflex artery. Look at that. This is a normal variation. It's slightly different, you know, like, so, and it goes to the apex of the heart. So artery for the heart, interventricular artery, anterior wall and interventricular septum, circumflex artery, go to the posterior wall of the heart. In the posterior surface, we have the left atrium, left ventricle, posterior wall, right coronary artery for the right atrium and the right ventricle. And we saw the great, middle, and small cardiac veins, and which finally go into the coronary sinus. Coronary sinus will go into the right atrium. Where is the coronary sinus? Here. This is the great cardiac vein, and finally we form the coronary sinus. This coronary sinus will drain into the right atrium, or the deoxygenated blood, which is used by the heart muscle, we go back into the right atrium. Right, so that is the heart, the blood vessels for the heart. And I'm nearly finished. So this is the first part of the heart, which we have to take a long time to start. And then just before I let you go, I want to show you these inside of the heart. Hey, you split my heart. You split my heart, and then now you can see what are the structures inside my heart. So this is the right atrium. This is the right ventricle. In between right atrium and right ventricle, there is a connection which is covered with the valve, which is called tricuspid valve. From the right ventricle going into the pulmonary trunk and pulmonary arteries, it has to go through the valves. The valves are like a door, you know, it open and close so that there is no continuous blood flow to make it more structured. Otherwise, all the blood will be draining here and there everywhere. So these are the doors which need to be closed and open as necessary. So these are the pulmonary valves. Look at that, pulmonary valves. And we lead into the pulmonary trunk, and we go into the right pulmonary artery and left pulmonary artery. We go to the lungs. The blood will be oxygenated and come back to the heart with two right pulmonary vein and two left pulmonary vein. All these four pulmonary veins, we open into the left atrium. We open into the left atrium. And finally, through the opening, which is guarded by the mitral valve, we go into the left ventricle, and left ventricle, we pump out blood into the aortic valve here, into the circulation. And try to appreciate inside of the heart. Look at that atrium. It is nice and smooth wall inside. Atrium, left atrium, nice and smooth wall inside. Ventricles, hey, it is a lot of muscle rugates, like a ragged muscles inside. And the wall of the atrium is thin. The wall of the left ventricle is thick. The wall of the right ventricle is thicker, but not as thick as the left ventricle. Of course, right ventricle has to squeeze the blood out of the chamber just to the lungs. The wall of the left ventricle need to be really thick and strong to pump the blood through the aorta into the circulation into every part of our body. And therefore, the thickness of the left ventricle is much bigger than the thickness of the right ventricle. And you can see a lot of muscle rugates in the ventricles, but pretty nice and smooth in the atrium. So the job of the atrium is to accept the blood from every part and then just let it go into the ventricles. The job of the ventricles are to squeeze the blood against the resistance to every part of the body. So that is there's a way, but whatever it is, let's keep going. So we can see the four chambers of the heart. On the right side, we have right atrium, right ventricle. On the left side, we have left atrium and left ventricle. And the walls of the atriums are thin, the walls of the ventricles are thick, and left ventricle is even much, much thicker than the right ventricle. And the inner surface is ragged in the ventricles, but pretty smooth out in the atrium. Okay, split the heart. Now we can see the thickness of the left ventricle and thickness of the right ventricle, splitting up and down as a corona. So these are the venous drainage of the artery and venous drainage of the heart. I believe you are fed up with this already, so I'm not going to repeat it. And this is the posterior portion. Try to appreciate the coronary sinus. Sinus means big pool of blood. It's coronary sinus, this coronary arteries, everything we merge here as a coronary sinus. And finally, this coronary sinus, we have to go into the right atrium because it is carrying all the venous blood. So it needs to go back to the lungs to get reoxygenated. And the middle cardiac vein, great cardiac vein, posterior cardiac vein, and we have the anterior cardiac vein. So these are the venous drainage of the heart. All right. So I'm going to stop here. It is like nearly 2 hours. Has any